Hi, you guys. I am here to support you in any way that I possibly can at this time through these videos. And right now, you might have just had a stroke, or you're a caregiver who has a loved one who had a stroke, and it's the beginning stages. Everyone is shocked, appalled, devastated. It's just so much going on. So, without further ado, I just want to help you with stroke recovery and where to start. Now, it can feel overwhelming at first, but starting the with the right priorities and with the recovery as soon as possible is very important. I'm looking over here because I do have notes that I'm referring to, okay, just so that I can stay on task and give you everything that I have here, okay? So the key is early, structured rehabilitation and consistent follow-up care. Okay, so here's just a clear roadmap of where to start. You want to stay connected to the stroke care team. If you haven't already, make sure you are under follow-up care with a neurologist and your primary care doctor, as well as your rehabilitation um, people. So that would be your rehabilitation team would be physical therapy, occupational therapy, and speech therapy. Whatever you need, whatever fits your situation right now at this time. Now, typically, if you are at a hospital and you were treated at like a big hospital, what have you, they already kind of have these things sort of squared away for you, probably have already explained a lot of this to you and have set this up, help you set this up. Okay, now the other piece is you want to start with rehabilitation as quickly as possible. Now, loved ones, caregivers, you have seen what happened. The person just had the stroke, and things might look and feel worse. They might look and feel worse than what they are. I'm just going to say that because for me, in my experience, when my loved ones had a stroke, it looked like what is going on, and like it looked like the end of days, and that's not the truth. Okay, just know that as soon as they are able, they might look like they're not able, but as soon as the medical staff says it's time, typically they'll start bringing rehabilitation, physical therapy, occupational therapy right into the room, because it is all about starting off, getting back to the baseline as quick as possible. And they always say that there's this window of like 6 months, you get the biggest, at the beginning, you get the biggest gains back to like independence and things like that. The sooner you start within the first few months, typically 3 to 6 months. I'm going to say that that is partially correct. I'm going to say that, yes, it could be faster, but it does not stop or end there. So be encouraged and know it does not stop and end there. All right. There is a chance and opportunities here for wellness all around. Okay, so like I said, the rehab should start as soon as possible. Physical therapy will focus on walking, balance, strength, and fall prevention. Leg weakness, if there's any weakness, arm weakness, gait training, was not arm weakness. Physical therapy is from the waist down. Occupational therapy typically is the waist up, although sometimes they'll team up and they'll both work on both together depending on what the plan is, what the goal is for the person. But physical therapy will work on core strength, gait training, and leg weakness. Occupational therapy will focus on daily living skills, dressing, bathing, cooking, fine motor skills like hand use, adaptive equipment. If speech therapy is needed, they're going to focus on speech clarity, swallowing safety, which is huge. Swallowing safety, language. So if the person has aphasia, they're helping them with their language, and cognitive skills, memory, and attention. Because what happens if the language area is damaged, then they may not focus in and stay focused on something, so they will help them with that. Now, if outpatient therapy isn't available, then you want to ask about home health therapy or tele-rehab options, okay? What my experience was is that you have the therapy in the hospital, and then from the hospital you go to a rehabilitation center. With my loved one, he was there I think maybe 2 or 3 weeks, and then they wanted to discharge him, but it was just way too soon. And so that decision was appealed, and it was agreed, okay, another week or another 2 weeks. I can't quite recall because it's been quite a while. But be open to appealing these decisions. It is free to do so. You want to be as prepared as possible when your loved one goes home. If you're the wife or child who's going to be helping a parent or whatever, or a parent who's helping a child, you want to be completely as prepared as possible. And if extending their rehabilitation is going to help, then you want to do that, because when they're in the rehab center, they're getting more time. Okay, that they're specializing in that. Now, also understand that in the rehabilitation center, if they choose to send your loved one home, that is in theory because they feel like it is no longer medically necessary for them to be there. Meaning, it doesn't mean that they don't feel they don't need rehabilitation. They don't necessarily feel they need the medical aspect of it, and that your loved one is stable enough to go home and continue therapy there. Now, the way it worked at the time in the United States with insurance is that you go to a rehabilitation facility and they send you home, and then you say, okay, fine, we're at home. Can we then sign up for outpatient? If your loved one is able, if you're able to get your loved one to outpatient therapy where it's not, really difficult for them, if they can help transport and transfer themselves from the bed to the chair, car, and all of that, then you can go to the facility as an outpatient where they have all of the things, all of the equipment and things at the facility that they can work on. There are options if that is not available. So if they say, well, no, has to be at home, then you can go home, and then it's going to be more of a scaled back rehabilitation. However, you can get very, very creative at home, and if you have financial resources, you can buy a few things that they have at the rehab facility that will help. Okay, so remember that. Even check with insurance to see what's available. But typically, the process is at the hospital, they start you with the therapy. Then you go to the rehab once you are discharged. Then from the discharge, you go outpatient. And then from outpatient, home therapy. So make sure you're getting all of the therapies and all of the steps. Now, if you go home, if you choose not to do outpatient, for example, and you go home and get the therapy, and then you decide, I really would like outpatient therapy, that is not an option. At least it wasn't then. It wasn't an option because it's a step. These are steps that you take. So if you're already at home, they're going to say, well, you're at home. You kind of skipped over the option to go to outpatient therapy, if that makes sense. Okay. The other thing I wish to share is prevent having another stroke. This is a very critical step, and this is just as important as rehab. Now, you're going to work with your doctor, of course, for blood pressure control, cholesterol control, in all the management, smoking cessation if you are a smoker or were a smoker, heart rhythm evaluations, things like that, and basic lifestyle things like various diets, how you're eating, what is more aligned with your wellness and healing. Stress management is huge. Stress management. Gradual physical activity as approved. The therapies are probably going to be approved, so you're good there. And sleep. Typically after a stroke, sometimes, your loved one, and I'm speaking to caregivers, I'm speaking to everyone who's in this situation, caregivers and those who are recovering from a stroke. Typically what happens is, you might get tired, and caregiver, your loved one might be tired. They may not want to participate in certain things sometimes, or you may notice them sleeping a lot. That is common. The body is trying to heal itself. It is detoxifying itself. The brain is trying to rewire. That's what the brain is doing when we're all sleeping. And whatever is learned during therapies and throughout the day with your loved one, when the body is going to sleep, the brain is cycling that information. The brain is rewiring into that new information. So just know and have grace there, and just understand. Okay. Also, emotional and cognitive recovery. Many stroke survivors may experience depression, anxiety, fatigue, as I just mentioned, brain fog, which makes sense, and maybe some personality changes. This is common, and it is treatable. So you want to ask about counseling, supportive groups that I mentioned in another video, support groups locally, and even Facebook groups, online groups, not just Facebook. You may find some online anywhere. Okay. Also neuropsychological evaluations. Okay. Check with organizations like the American Stroke Association. They offer education and survivor support networks as well. The other thing, home setup and safety. Start with removing tripping hazards. Install grab bars if necessary, if you can. Get a shower chair, night lights, medication organizer, pill crushers, things like that. And an occupational therapist can do a home safety evaluation to help you out with that. And then with this one, I want to keep this as short as I can. Set small, measurable goals. Recovery is not linear, okay? Improvement often continues for 3 to 6 months, 1 to 2 years gradually. Like, it continues. I see improvement all the time with my loved one, okay? So, and sometimes longer. So, examples: walk 10 extra steps this week, button a shirt independently, practice speech exercises daily for 15 minutes. Consistency matters, and it matters more than intensity. So even if it's not perfect, just show up. Just show up. Last but certainly not least, caregiver support. Caregivers, educate yourself. Schedule respite breaks. Even though you might be overwhelmed and confused right now, just make sure you have that presence of mind to schedule the respite periods where you are taking breaks to prevent burnout. Be gentle with yourself, take care of yourself, and also look into the caregiver support groups that I mentioned in my other video. Facebook groups, but also local groups. Check with the United Way if you're uncertain. Check with the city hall, your community, your city. Check with them. Burnout is common, but it's preventable. Okay. So that's all I have for now. I want you guys to live simply, be kind, be well, wishing you so much healing and love.